I saw two patients in consultation today that both had a recent history of an ectopic pregnancy. One was treated with methotrexate and the other one, it ruptured and they needed surgery to remove the tube. And they both happened to ask me the same question that they had Googled an answer to and they were very confused about. They said, why does it sound as though IVF pregnancies have a much higher risk of ectopic? Aren't you bypassing the tubes? What's the deal? So yes, according to the data, IVF pregnancies have a higher likelihood of resulting in an ectopic pregnancy versus those that are conceived without assistance or with IUI. And at first glance, this makes absolutely no sense. Overall, the risk of ectopic tends to be quite low. Obviously, it depends on the population you're looking at, but the overall risk is quite rare. With unassisted pregnancies, the ectopic pregnancy rate is about 1 to 2%. With IVF pregnancies, it's quoted as a rate of 2 to 5%, depending on various factors. I do think it's important to point out a major factor that could have contributed to this statistic, which is based on most likely old, outdated data. Back in the day, not that long ago, but decades ago, we were doing IVF very differently. We didn't know how to grow embryos out to the blastocyst stage, so at day 3, we were putting back multiple, sometimes up to 5 embryos at a time, because it was so high stakes and the success rates were really low, and this was one way to counteract that. And think about the statistics and probability of it all, right? The more embryos in the uterus, the more of a chance for one of them to be wayward and float into the fallopian tube and get stuck, right? More embryos, more problems. I think that's a song lyric, right? Nowadays, most modern day IVF clinics are mostly growing embryos to the blastocyst stage, and that has, along with genetic testing, allowed us to be better at just putting back one embryo at a time. So when you're doing single embryo transfer, I don't know that the risk can still be quoted as 2 to 5% rate of ectopic. Another thing to consider is the fact that some people are doing IVF because they have damaged tubes, and they may be doing a transfer and then if the embryo migrates, which sometimes they can move around, into the fallopian tube and that fallopian tube is damaged, it's not going to do its job necessarily, which is its cilia, the hair that lines the fallopian tube, are supposed to push the embryo back to its position. And if you have a damaged tube at baseline, maybe you have endometriosis, maybe you have inherent inflammation in the reproductive tract that has affected the tube's ability to function normally. And so if that migration of the embryo occurs, it can't be corrected as easily as it would be in someone who doesn't have those issues. Another thing that might be outdated when it comes to this data, this 2 to 5% rate of ectopic in IVF pregnancies, is that it may have not been standard across the board for everyone to do embryo transfers under ultrasound guidance. And I do think that transfer technique is important. Now, that's not to say that when an ectopic happens after IVF, it means that there was poor transfer technique. Embryos can migrate, as I said, but if you know where you're putting the catheter and you're not putting it too high, you can really minimize the risk of that happening. I do think another major factor that can link IVF pregnancies to a higher risk of ectopic is that a lot of our patients with infertility may also have uterine or pelvic cavity abnormalities. This tends to be more common in the IVF population and those with infertility, and that could impact the ability of an embryo to implant in the normal position. An interesting fact is that frozen embryo transfers have a lower risk of ectopic associated with them versus fresh transfers. And we think that's because the uterine cavity is a more normal environment and more receptive to letting an embryo implant properly where it's dropped off during the transfer, in a frozen transfer cycle where it's a more natural environment versus a fresh transfer where you're putting the embryo back shortly after stimulating the ovaries, and that throws things off with the lining and maybe makes it less receptive. In practice, in reality, what I see day to day is that ectopics after IVF are increasingly rare. I think that's especially true if you're doing a single embryo transfer, it's a frozen transfer in a more natural environment, whether that's a medicated or cryo-natural cycle versus a fresh transfer. And I also think it could be possible that transferring at the blastocyst stage also reduces the risk, because that's what stage an embryo should be at when it's arriving at the uterine cavity to implant. Day 3 embryos, when they're forming in your body, are normally still in the fallopian tube. So I think all of the changes that have led to the modern way of practicing IVF may be contributing to a lower risk of ectopic pregnancy, but it is important to know that it is still possible. And a big PSA is for anyone who's had prior ectopics, whether they were trying on their own or with IUI, and now you're moving on to IVF, don't forget to assess the tubes, because if there's any residual damage or an underlying problem with the fallopian tubes like a subtle hydrosalpinx that led to the ectopic or maybe resulted from the ectopic, these are all things that can still impact the success of a future embryo transfer, because the tubes are in communication with the uterine cavity. So always get tubal assessment and make sure that you leave no stone unturned.